Dünya Sağlık Örgütü Türkiye Ülke Ofis Temsilcisi Dr. Batyr Berdyklychev bizimle birlikte olacak. Hi Mr. Berdyklychev, welcome on show. First of all, I would like to start with the current picture of global coronavirus and the vaccination procedures. How do you define them?
Good afternoon, and thank you for inviting me. First of all, I have to say that unfortunately we stepped into 2021 with COVID still dominating the agenda for many countries. Just last week, WHO was notified about 95 million cases occurred since the beginning of the outbreak globally. And unfortunately, the world also crossed the grim milestone of 2 million reported deaths. That's a huge number. Shortly, there was some decrease in reporting new cases after the New Year and holiday period. But overall, upward trend has resumed now. I can say that only last week, nearly 5 million cases and over 94,000 deaths were reported to WHO. These are the highest figures so far. In the European region of WHO, where Turkey belongs to, about half of the countries, including Turkey, seeing newly reported cases being to decrease. This is a positive sign, of course, but it's too early to relax. As to the vaccination campaign, this is very encouraging development, of course, because development and approval of a safe and effective vaccine within such a short period, it's enormous scientific achievement. I can say that so far 40 million vaccine doses have been administered globally, but unfortunately 95% of these vaccines were used in just 10 countries, and it's predominantly high-income countries. And this, of course, poses a very serious problem with equitable access to vaccines by all countries.
Yes, when we previously made this hit, the previous doctor told that our strength is the most weakest one. So we are as strength as the weakest link, let's say.
Yes, that's absolutely correct.
The next question, what is the latest update coming from the COVID-19 as a mutation part arranged in the UK?
At the moment, we are informed about multiple variants, so when the virus mutates. Now, 60 countries globally reported a new variant, which was first detected in UK. But there are also variants in more than 23 countries, which was also detected in South Africa. We're actually getting notifications about another variants in Brazil, Japan, Russian Federation. So it is important to understand actually that with the increase of surveillance and genomic sequencing of SARS-CoV-2 viruses, we will continue to detect new variants, because the wider virus is spread, the more we should expect mutations. This is a normal process for viruses. Every single variant gets characterized by scientists to understand whether they have potential implications on our health. And as of today, the variants identified seems to be of similar disease severity. So the disease are not affected, the severity of the disease. But some of the variants more easily transmittable from human to human. This just confirms that preventive measure we have currently in countries, and in Turkey particularly, still need to be observed in the future.
Last question. Turkey took several steps in fight with the COVID-19. Cases declining, vaccination started. So what is next for Turkey?
Yes, I have to agree with you on the steps taken. Turkey actually taking very balanced approach. I have to know that within 1 week, almost 1 million of people get vaccinated. This is a huge achievement. There also a number of cases getting decreased, and this is the result of restrictive measures which are in place in the country. It's a weekend lockdowns, it's a curfew during weekdays, mask wearing, very high compliance in the country. What's important and what's the next? There is no prescribed recipe what to be done. I think that it should be a complex approach with continuing vaccination, but also compliance with regard to the restrictive measures. We can expect that with the improving of the epidemiological situation, some restrictions can be lifted gradually, particularly with regard to the schools, because children being out of schools, it affects their physical, emotional development, and schools need to be opened first and closed last. So, having said that, what's important is to continue monitoring the epidemiological situation, analyze it, and respond accordingly to the challenges and to the situation, which Turkey is doing quite well.
Thanks, Mr. Berdyklychev, being with us and sharing those details.